When your gut thrives, your whole body feels it. Energy, immunity, mood, and longevity follow. Taking care of yourself isn't optional. It's how you sustain long-term physical, mental, and emotional well-being. One foundational layer of that self-care is gut health. Your gut, digestive system and microbiome plays a central role in digestion, nutrient absorption, immune defense, hormonal balance, and even the gut-brain axis, mood, cognition, stress. Poor gut health can undermine how you feel, how well you recover, and how resilient you become over years. By learning how to eat in a way that supports gut balance, you give your body a stable foundation to thrive. Your gut is resilient, but modern lifestyle pressures often strain it. Some common contributors: poor diet quality, high ultra-processed foods, refined sugar, low fiber, little variety, low dietary fiber, prebiotics, not feeding beneficial microbes, frequent antibiotic, medication use, NSAIDs, proton pump inhibitors, etc., chronic stress, cortisol and sympathetic activation impair gut motility and barrier function, lack of sleep, disturbs circadian rhythms and gut microbiome cycles, sedentary behavior, low movement, reduces circulation and slows digestion, excess alcohol, smoking, toxins, irritate gut lining, promote dysbiosis, food sensitivities, intolerances, gluten, lactose, FODMAPs, etc., hydration neglect, low water intake slows transit, thickens mucosal layers, underlying health conditions, IBS, SIBO, inflammatory bowel disease, metabolic syndrome. When multiple of these factors accumulate, your gut environment shifts: less diversity, more inflammation, leaky, barrier, suboptimal digestion, and poorer systemic health. Poor gut health doesn't always stay local. It can contribute or exacerbate conditions elsewhere: inflammatory bowel disease, IBD, Crohn's, ulcerative colitis, irritable bowel syndrome, IBS, SIBO, small intestinal bacterial overgrowth, leaky gut, increased intestinal permeability, potentially fueling systemic inflammation, metabolic syndrome, insulin resistance, obesity, non-alcoholic fatty liver disease, NAFLD, autoimmune conditions, through immune dysregulation, allergies, food sensitivities, systemic inflammation, mood, mental health issues, depression, anxiety, via gut-brain axis, skin disorders, eczema, acne, psoriasis, nutrient deficiencies, poor absorption of vitamins, minerals, B12, iron. In other words, the gut often becomes a tipping point for systemic decline when neglected. Here are signals your gut may be under stress: recurrent bloating, gas, distension, irregular bowel movements, constipation or diarrhea, abdominal discomfort, cramping, reflux, food sensitivities, intolerance, chronic intolerance to certain foods, fatigue, brain fog, low energy, frequent infections or weak immunity, unintentional weight gain or lost, skin issues, rashes, acne, low mood, anxiety, disrupted sleep, joint pain, systemic inflammation. Signs: nutrient deficiency markers, anemia, hair loss, brittle nails. If you experience several of these, your gut health deserves attention. Below is a roadmap to gradually improve gut health through nutrition and supportive lifestyle measures. 1. Embrace microbiome-friendly foods, fiber and prebiotics. Foods that feed beneficial bacteria: fruits, bananas, apples, berries, vegetables, onions, garlic, leeks, legumes, oats, flaxseed, barley, whole grains, fermented, probiotic foods, live beneficial microbes, yogurt with live cultures, kefir, sauerkraut, kimchi, tempeh, miso, kombucha, polyphenol-rich foods, plant compounds that promote microbial diversity, berries, dark chocolate, cacao, green tea, nuts, spices, turmeric, ginger, resistant starch, cool potatoes, green bananas, cooked and cooled rice, healthy fats and omega-3s, support anti-inflammatory balance, fatty fish, flaxseed, chia, olive oil, walnut, avocado. Diverse plant foods. Aim for many types of plants weekly. Variety helps microbial diversity. 2. Eliminate, reduce irritants and triggers: refined sugars, artificial sweeteners, especially some sugar alcohols, excess processed foods, trans fats. Alcohol in excess foods you suspect cause intolerance, gluten, lactose, high FODMAP foods. Consider an elimination diet. Over-reliance on medications, NSAIDs, PPIs, when safe, discuss alternatives. 3. hydration and regular meal timing. Drink adequate water, supports transit, mucus lining, microbial environment, avoid long fasting or erratic eating, keep consistent windows that align with circadian rhythms. 4. Movement and gentle exercise. Walking, yoga, light cardio all support healthy gut motility. Avoid overly intense sessions when gut is disturbed. Stress response can amplify gut symptoms. 5. Stress management and sleep practices. Meditation, breathing, journaling, nature time. Sleep hygiene, consistent schedule, dark room, screen limits, restful environment. 6. Gradual reintroduction and testing. After stabilization, reintroduce suspects, e.g. dairy, high FODMAP foods, slowly to test tolerance. Use food journaling to track what meals cause symptoms. 7. Supplements and professional support, as needed. Probiotic supplements, multi-strain, clinically tested, prebiotic fiber, inulin, psyllium, start small digestive enzymes or beta-HCl, under supervision, glutamine, zinc, L-glutamine plus other gut healing amino acids. When appropriate, work with registered dietitian or gastroenterologist for chronic disease guidance. 8. Monitor and adjust. Track symptoms, stool quality, energy, mood. Adjust dietary diversity, volume, or fermentable load. Gradually. Be patient. Microbiome shifts take weeks to months to maintain strong gut health long term. Embed habits into your life. Daily eat 25 to 35 plus g fiber from varied sources. Include a fermented food or probiotic item. Drink water. Avoid dehydration. Moderate stress breaks, breathing, short walks. Move daily, even light activity. Sleep well. Limit screen time before bed. Weekly plan meals with gut health diversity. Avoid eating the same meals too often. Rotate protein, vegetable, fiber sources. Light, gut reset days, e.g. simpler meals, more plants, gentle movement, yoga or mobility focused on digestion. Monthly, quarterly. Evaluate dietary variety, symptom trends. Reassess sensitivity. Elimination, test reintroductions. Lab checkups, inflammatory markers, gut health markers, if indicated. Adjust macro-calorie intake to support vitality rather than stress. Traditional wisdom. Many traditional diets, fermented foods in Asia, Africa, Europe, recognized the role of fermented foods, fiber-rich staples, and food rotation long before modern microbiology. Emergence of microbiome science. Over recent decades, research has uncovered the trillions of microbes in our gut and their role in immunity, metabolism, mood, and disease. Origins of probiotic concepts. Mid-20th century scientists first classified probiotics, live beneficial bacteria, and prebiotics, food for them, within nutritional science. Modern clinical trials, human trials now explore how dietary fiber, fermented foods, specific probiotics, and microbial diversity correlate with reduced disease risk, diabetes, obesity, IBD, and improved biomarkers. Gut-brain axis research. The bidirectional communication between gut microbes, neural signaling, and stress, mood has become a cutting-edge field, psychobiotics. Thus, eating for gut health isn't a fad, it's rooted in centuries of food wisdom now validated by science. What can happen if you perpetually neglect gut health? Chronic inflammation, fueling systemic disease. Persistent GI disorders, IBS, SIBO, dysbiosis, weakened immunity, more frequent infections. Poor mood regulation, brain fog, anxiety or depression. Nutrient deficiencies, malabsorption. Escalation of metabolic diseases, obesity, insulin resistance, fatty liver complications like leaky gut contributing to autoimmune disorders. Progressive decline in vitality, quality of life. The gut is one of the core control centers. Ignoring it forces consequences beyond digestion. Your gut is not a passive tube. It's an ecosystem, a communicator, and a gatekeeper for your health. Eating for gut health means choosing foods and habits that support microbial balance, reduce irritation, and build resilience. It's not about perfection, it's about consistency, diversity, and listening. Make gradual changes. Swap processed for whole, add fermented foods, rotate plant diversity, manage stress, sleep well, hydrate, and move. In time, you'll likely notice less bloating, more energy, better mood, and improved overall well-being. This content is for educational and informational purposes only and does not replace medical or dietary advice. If you have gastrointestinal disease, IBD, celiac, SIBO, food allergies, or other medical conditions, consult a qualified gastroenterologist or registered dietitian before adjusting your diet or supplementation.